the takeaway here, it's worth understanding the plan you have and the free services available to you. Don't forget to remember too that the free stuff or the covered service description can be very, very narrow. If your visit expands beyond the defined service, you may have a charge for that service.
Welcome to Under the Coverage.
During each episode, we interview people, sometimes it's just each other,
who spend their working days focused on health benefits and health care.
As consumers, we want the same thing you do.
We want the entire system to be less complicated.
Our guests share insights about how they navigate healthcare and the health benefit systems. I'm Jolene Myers.
And I'm Sara Flusky.
And we're ready to lament,
complain,
empathize,
and maybe help a few people. Jolene, it's just you and me today, and it is Preventive Services time. This is the episode where I am going to try not to say USPSTF a million times, but it's going to be really hard. Let's talk about preventive services.
All right. The USPSTF is the United States Preventive Services Task Force. So I think the acronym is a bit easier to say. Maybe one could argue that. So this is independent of the U.S. government.
Right. Not a government entity, which I found that interesting because I have U.S. I assumed it was a government entity. It is, in fact, a third-party organization.
Independent panel of experts in primary care and prevention. They review the effectiveness of screenings, counseling, and preventive medications. They also develop recommendations for services that prevent illness or detect conditions early when they are more treatable. They have this list of recommendations that outlines the type of service, the age group impacted by the service, screening or medication, the year it was evaluated, and the category of disease or condition the recommendation addresses. For the purposes of today, because we don't want to spend 45 minutes on this, is just to chat about the recommendations with a grade of A or B. So grade A or B reflect the certainty of the panel that there is a substantial or moderate net health benefit. The ACA requires coverage of the USPSTF grade A or B recommendations with zero share to the member, zero cost share to the member.
Those are within every benefit plan. The Affordable Care Act or the ACA required certain preventive services and screenings to be covered at zero cost share to the member. The ACA uses the USPSTF guidelines that have an A or B recommendation to be included at this zero cost share. It's insane, but the
more letters.
Right. But the list is clear in terms of what it covers. The problem is almost like what it doesn't. So when you look at this USPSTF list, and there's a link in the bio for this particular episode, that list goes over what is covered at A and B rating for zero cost shares.
So it's important to know that this list is not static, right? So it's evolving, it's updated all the time.
Yes, because as treatments and screenings advance and we learn more, things get added, things get taken off if there's a better way to screen for something. So it does change, and then it changes what has to be included in the plan at $0. August 2019, the USPSTF recommended that primary care clinicians assess women with a personal or family history of breast, ovarian, tubal, or peritoneal cancer who have an ancestry associated with breast cancer susceptibility 1 and 2, so BRCA1 or 2 gene mutations with an appropriate, brief, familiar risk assessment tool. And women with a positive result on the risk assessment tool should receive genetic counseling and, if indicated, after counseling, genetic testing. Another example is April 2024, the USPSTF updated the recommendation for mammograms for women aged 40 to 74 every other year. So if your doctor thinks that you should have one every year because maybe you have a family history or there's different sort of risk for you, on the other years, it wouldn't be covered at zero copay. If you go in for a mammogram and it's every other year, as recommended by the USPSTF, if you need additional screenings beyond that primary screening, that wouldn't be covered. It's really narrowly defined what is covered, because sometimes, you would go in for a mammogram and if they say, you have dense breast tissue, so I'd like to do a different type of scan, that other scan might not be covered. It's certainly something that you would want to get done if there's a reason to have that test done. But the initial screening is covered. It's possible that any of those follow-up screenings or additional visits aren't going to be covered, because really all that's required is that initial screening. So what is $0 is really narrow, and it can very easily become a copay or a deductible cost to continue on with screenings or different types of screenings if that's where you need to go.
Gestational diabetes is next on our list, right? So that was last updated August 2021, but it includes a recommended screening in asymptomatic pregnant persons at 24 weeks of gestation or after. They give you the can of pop and a couple Tootsie Rolls. I had that experience. I did not have GD with my daughter, but my second pregnancy with my son, I did. And that was a whole gamut of fun things to go through the last several weeks of pregnancy, like you don't have enough to go through. But so that's on the list. What else we got here? Annual
screening for lung cancers with low dose computed tomography or LDCT in adults aged 50 to 80 years who have a 20-pack a year smoking history and currently smoke or have quit within the past 15 years. The screening should be discontinued once a person has not smoked for 15 years or develops a health problem that substantially limits life expectancy or the ability or willingness to have curative lung surgery. What that means really narrowly is if you're 47, it is not a $0 screening. It doesn't mean it's not worth having. But from a cost perspective, the USPSTF advises through the Affordable Care Act that it is covered if you are between ages 50 and 80 and have a 20-pack per year smoking history and currently smoke or have quit smoking within the last 15 years. That's narrowly $0, right? And even if you have that screening done, if there's any cause for concern, any of that follow-up won't be the $0. Then your copays are going to kick in or your deductible cost sharing towards those additional screenings or visits. It's helpful to know, kind of lame or boring as USPSTF is, it's really clear in terms of how narrow that definition of what is $0 to the member, and then why it might be included on a plan or not included on a plan. And it's very narrowly that thing, which is frustrating, but more helpful if you understand going in why, if you think breast cancer screening is supposed to be $0 and you need additional screenings or a second screen at your first appointment, that second one might not be covered at the $0 because it's beyond the initial screening, if that makes sense.
Yes. So next on the list, we've got clinicians are recommended to ask adults and pregnant people about tobacco use, right? So when you go to the doctor, typically they'll ask that question. If they're not, if they don't, they should be. And then providers or clinicians are going to ask those to stop using it and provide behavioral interventions for cessation. So for non-pregnant adults, they recommend FDA-approved pharmacotherapy to aid in cessation.
Yes, that is very narrowly what is covered at $0.
And then we've got the USPSTF recommends vision screening at least once in all children aged 3 to 5 years to detect, how do you say this one?
Amblyopia.
Thank you. Or its risk factors. This one-time screening would be covered at $0. If you take your child more than once or if something else comes up in a screening that requires additional testing or medical visits, those would be covered based on your medical plan, but would not be $0 unless your plan offers these for $0, right? So that's going to be dependent on your employer's healthcare plan.
Right. The ACA, the Affordable Care Act, requires the A and B recommendations of the USPSTF to be covered at $0, but it's a super narrow list of things. So there are guidelines to tell you exactly what is covered, but it's really easy to fall into something that's not covered at $0. It doesn't mean you don't want the screening. It doesn't mean you shouldn't keep going for those things, but there's a really long list of things that are $0. So at the very least in your plan, you should get those things done when they're available to you, all those preventive screenings, because ignoring some of those things, while it saves money in the short term, in the long term, the sooner you know about some of these things, the earlier you can start to take care of them, and at a lower cost than at a catastrophic point. I both love and hate the USPSTF recommendations, but it has helped me to better understand my plan and at least understand these things to you they cost nothing. That is a federal requirement for all plans. It's helpful, if not very nerdy.
Well, it's always nerdy, right? But I think we just talked about screenings and services. Let's hop to immunizations.
Oh, yep. There's a list for that too. So outside of the USPSTF, the ACA outlines routine immunizations that are covered at a $0 copay. The list of immunizations recommended are reviewed by the ACIP, or Advisory Committee on Immunization Practices. The ACIP is a committee within the CDC, which is the Centers for Disease Control and Prevention. I feel like Chandler Bing. Could there be any more acronyms? But with all the acronyms out of the way, the list is routinely reviewed and updated and includes immunizations like RSV, hepatitis A, Hep B, influenza, MMR for measles, mumps, and rubella, chickenpox, polio, and more. And health plans are required to provide coverage without cost sharing to the member for ACIP recommended vaccines. So in the notes for this episode, there's 2 links for ACIP for people who want to learn more. So the USPSTF makes those recommendations for screening, and then ACIP makes those recommendations for which immunizations should be covered.
With all of this, there's always caveats, right? In general, the takeaway here is it's worth understanding the plan you have and the free services available to you. Don't forget to remember too that the free stuff, or the covered service description, can be very, very narrow. If your visit expands beyond the defined service, you may have a charge for that service. And for any screening or visit, if you need additional screenings, discussions, or testing, you might have an additional copay tagged onto it. So just be aware of that.
Mm-hmm.
And EOBs, you like to talk about EOBs.
Love EOBs.
That's a safeguard, right?
Yep.
I mean,
as soon as your claim is adjudicated or it's paid on the administrative side, once you get that EOB, that's sort of your first check on whether or not you should be expecting a bill. If that comes through and it shows $0 responsibility to the member, it has adjudicated at that $0 level. If you see anything outside of that with any member responsibility, then you kind of got a heads up, there's probably a bill coming. So that's the right time to call the provider, call the insurance company, call your plan administrator to understand how the visit or the injection or immunization, how something was billed and what made it not a covered service if you were expecting a $0 copay.
Yeah, just trying to connect all these dots, right? So you sign up, you get employee benefits. What does that all mean? What's covered? What's not? As you mentioned in a previous episode, understanding your zero is important. And again, you can always call if you've got questions. All right, we're living up to our name here on Under the Coverage.
It's really deep under the coverage.
Yes.
It's the details behind the coverage.
Yeah. Plus some acronyms. We're always good for that.
This is the box spring of Under the Coverage. Well, thank you for talking about USPSTF with me. I love that.
No prob. Thanks.
Thanks, Joe.
This podcast was brought to you by Nova Healthcare Administrators.
Do you have a question or a situation you'd like advice about?
You can find us on Twitter at UNDR The Coverage.
If you're into email, you can reach us at podcast@novahealthcare.com.
Don't forget to leave a review, give us a like, or subscribe, but more importantly, share.
We'll find the insiders. You share it with the outsiders.